Alright, now we're going to review side-lying scapular PNF slow reversals. So we're going to start with up to the nose, down and back again. So that would be anterior elevation, posterior depression. So I'm making sure that the patient is in a good solid hook line position. Probably could scoot your torso back just a little bit towards me. Obviously you want them to feel stable, like they're not going to fall off the table, but you do want them to be close to you because that's where you get your strength and how you protect yourself from leaning way over the table or something like that. So Mindy here really likes to protract when I ask her to come up to her nose, so you'll hear me correcting her a little bit on that. And so again, patients always want to know, what do I do with my arm? And it really doesn't matter. It's whatever you can do that will help you keep your shoulder in the right pattern or diagonal. Your arm doesn't really matter, so I just pretty much tell them do whatever you want. Sometimes I'll have them start this way. It just seems like that's a little more comfortable for them, but whatever the patient wants to do is fine. All right, so my hand placement is here over the kind of the anterior shoulder, and then I'm almost cupping here with the anterior deltoid a little bit, again using lumbrical grip. I'm not gripping, there's no thumbs really involved here, okay? So pull up to your nose. See, you're already coming straight that way, so come up to your nose, up. Okay, I'm going to help her a little bit because this tends to help a little bit too. So come up to your nose. So I'm just guiding her down and back, up to your nose, perfect, down and back. Now I'm going to give a little resistance up to your nose, okay, and push down and back, up to your nose, good, that was perfect. Push down and back, up to your nose, push down and back, pull up and forward, good, down and back, up and forward, down and back, up to your nose, push down, pull up, good, push down, good, get that shoulder into the back pocket on the way down, push down, good, up and forward, push down and back, and just hold that. So now you'll see my hand placement for the posterior aspect of the diagonal. I've got this hand kind of butted up against the inferior angle of the scapula, and this hand's kind of just on the opposite side of the inferior angle of the scapula. So while she's up to her nose, once I get my hands here and she engages that posterior aspect of the diagonal, her shoulder blade just kind of comes right into my hand and gives me a little bit of something to grip onto. So that's the proper hand placement for that technique.